Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 820 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM and 1050 a.m. in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we're pleased to be joined by Melissa Hurd, the Acting Director and Executive Officer for Region 3 of the U.S. Department of Health and Human Services. Director Hurd joins us for a conversation about her career, the work of HHS across Region 3, which includes Virginia, West Virginia, Maryland, D.C., Delaware, and Pennsylvania, National Minority Health Month, and more. We'll get to all that in just a moment, but first, welcome to the program, Director Hurd. Thanks for being with us.
And thank you so much, Julian, for having me. I'm looking forward to our conversation.
Likewise. Well, let's get that conversation rolling. We like to start episodes by giving guests an opportunity to share a bit more about themselves. What we know about you is that you've been with HHS through several presidential administrations, including Bush, Obama, Trump, and Biden, and you've been the regional executive officer role for the better part of a decade. Your background includes work with the Centers for Medicare and Medicaid Services as the national lead for faith-based initiatives. You've also held roles with the American Red Cross. Those few professional details, I'm sure, just scratch the surface of who you are, Director Hurd. So if you would, start off by just telling us a little bit more about yourself and your unique personal story.
Great. So thank you again for having me on your show. Let me just start by saying that I'm born and raised in St. Louis, Missouri, so I'm originally from the Midwest. Moved out to the East Coast to go to college at Smith College in Northampton, Massachusetts, and then moved to D.C. and then to Philadelphia. When I came to Philadelphia, I started out at the University of Pennsylvania and then moved to the American Red Cross, where it was my job to go out and to solicit blood donations, get organizations, particularly faith-based and community-based organizations, to host blood drives for children with sickle cell. And we would host these blood drives, and at that time, there was a blue tag program at CHOP and St. Chris where people could designate that their blood donation go to children with sickle cell. And because I had done that for a number of years and worked on the ground, grassroots organizing, faith-based, community-based, and nonprofit work, I was hired by the federal government in 2004 to work with organizations for the Medicare Modernization Act, otherwise known as MMA, under President Bush. And that's how I got my federal career started.
Excellent. Well, I appreciate that walk down memory lane. And as a former Philadelphian, I lived in Northeast Philadelphia for 6 years. I certainly can appreciate some of those local references like CHOP. So appreciate that. Let's talk a little bit about the scope and breadth of HHS, which you just mentioned, which you've been with since 2004. HHS has 12 operating divisions, including 9 agencies in the U.S. Public Health Service, and then 3 human service agencies that administer a wide variety of health and human services. They conduct life-saving research. This includes agencies focused on children and families, advanced research, emergency planning and preparedness, healthcare quality, CMS, we obviously mentioned, the Centers for Disease Control and Prevention, the Food and Drug Administration, the National Institutes of Health, SAMHSA, and more. I think it's clear that HHS plays a significant role in advancing and safeguarding public health for Americans, even if some people may not be aware of the role of HHS in everyday life. From your vantage, Director Hurd, can you share some perspective about the work of HHS?
Absolutely. So let me say first and foremost, the mission of HHS is to advance the health and well-being of all Americans. And we're not just talking about their physical health, we're talking about their mental health as well. And so what we do at HHS and all of the organizations under that umbrella, as you mentioned, CMS, the Centers for Medicare and Medicaid Services, SAMHSA, Substance Abuse and Mental Health Services Administration, HRSA, Health Resources and Services Administration, and then also ACF, the Administration for Children and Families, FDA, Food and Drug Administration. The list goes on and on. What we do throughout all of those programs and agencies is we are making sure that the American public is safe. And so that means that we are on the ground, first of all, listening to our stakeholders, listening to our partners, making sure that they understand what is available in the government space and also how those programs are affecting the communities and the people that we serve. It doesn't make any sense for us to have programs that people, A, don't know about, and more importantly, if they know about them, they can't access them. So one of the things that we're striving to do here in Region 3 is making sure that we're not doing business or government as usual, that we are leaning into the space of health equity. No other way is that more clear than National Minority Health Month. And of course, they designate it as 1 month a year in April, but we know every month is Minority Health Month because people need to see their physicians, have relationships with their primary care physicians, develop information streams and education with their clinicians and providers. So we know that that's happening throughout the year, not just 1 month a year, but HHS is leaning into that space. And we're looking at all of our programs and saying, how can we do things differently? For example, we know that statistics shows us that people who take advantage of the 988, the mental health crisis and hotline, they want to hear from people who may have the same lived experience. Or when people go to physicians, they may want to see someone who looks like them. So HHS is working with historically Black colleges and universities, and we're trying to make sure that we are increasing health care workforce development, that we are moving individuals through these organizations, through these institutions, so that they, after obtaining their degrees, they may come back and say, how can I be employed? How can I help and serve the community that I was a part of? So that's just one step, but there are many others, and we're so happy that HHS is working with community and faith-based organizations to bring those results to fruition.
Well, a lot of good information there. I want to touch on several things. You referenced National Minority Health Month, and we're going to get to that in more detail in just a moment. But one point you made, which I think is really salient, is this idea that if there are resources available and the public doesn't know, isn't aware that those resources are available, they aren't necessarily being put to use. And I think that's a really smart point because that's actually something that we've done here in Virginia. Just a few months ago, we launched a statewide public education campaign about consumer-focused healthcare reforms, about laws that have been passed in Virginia to benefit healthcare consumers, to make them more educated of their rights under the law. And we did a lot of research on this, and what we found out was that people didn't even know these things existed. And we further asked people, who do you think is responsible for communicating this to you? And their response was they really thought it was government entities or health insurance companies, but no one was doing that communication. And so we took the initiative to actually do that through the Control Your Care campaign. And so that point you made, I think, is a really good one, that it's obviously important to take concrete policy steps, but that has to be followed up with public education and awareness so people know, hey, these tools are out there.
Exactly.
With that said, I do want to come back to this notion of National Minority Health Month. You talked about several things: health equity, health disparities, workforce development. All of these things are tied into overall public and community health. As we mentioned, we are recording this in April with Director Hurd, which is National Minority Health Month. It's an annual observance that builds awareness about the health disparities that persist among racial and ethnic minority groups. This year's theme is Be the Source for Better Health, Improving Health Outcomes Through Our Cultures, Communities, and Connections, with a focus on understanding how the unique environments, cultures, and histories and circumstances, sometimes known as social determinants of health, or in previous parlance, population health, of racial and ethnic minority populations and how that impacts their overall health. we know there's ample data indicating that disparities exist in health outcomes, chronic condition rates, maternal mortality, and other health markers. I can tell you, Director Hurd, that the hospital community here in Virginia is very much engaged on these things, whether it's through violence reduction initiatives, addressing maternal mortality disparities, and a whole wealth of other things. But with that background, both about some of the things that are going on in Virginia as well as National Minority Health Month, Director Hurd, I wonder if you could tell us more about this initiative and ongoing efforts related to it.
Absolutely. So, Julian, let me just say that Minority Health Month is a time to acknowledge and raise awareness about health disparities among historically disadvantaged minority populations in our community and in our country, and what President Biden is doing to close this gap. While the observance may come once a year, as I mentioned previously, this administration has made it a priority to put equity at the center of all its work. Again, that goes back to we can't continue to do business as usual. We have to lean into the space of equity. So we are taking great strides to improve access to health for all Americans. It's important to recognize that disparities persist due to the structural and systemic discrimination that has been built into our health system, which makes it harder for many people of color and minority groups to access affordable health care. So one of the things that the president has done is, of course, taking up the fight for prescription drug costs. He is lowering the cost of prescription drugs, and by doing that, he's lowering health care costs for all American families and prescription drug costs specifically for older Americans and people with disabilities enrolled in Medicare. So we want to make sure that people understand what's happening and how they can be a part of it. You asked a question before about who knows about this information and how can we tell people about it. It's not just a one-way street with the federal government, but it's the federal government partnering with organizations like VHHA and others who are on the ground, who are able to tell people that this is what's happening and these are the resources that are available in your community. Another example, this past week is Black Maternal Health Week, and I was in Virginia, Newport News, Hampton Roads, the Tidewater area with VHHA, Centera Healthcare, and other partners, and we had a day and a half maternal health convening. And that was all about making sure that people had resources in that Tidewater area so that they can take part and understand what's available to them, whether it be a doula, a midwife, education, managing chronic conditions prior to expecting, and then once you know you're expecting, what to do when you are pregnant and how to manage diabetes and hypertension, et cetera, et cetera. All of that information was available. But guess what? It would not have been available and accessible if not for the local community organizations. And that's where we need to get to, whether it's maternal health, health equity, opioid use, any number of things, behavioral health, mental health. We need to make sure that we are partnering the community, the trusted messengers, with this information.
Well, I am aware of that maternal health event that you reference, and we know that that is just one example of the engagement and the presence of HHS in Region 3 here in Virginia and beyond. Also want to point out that you, Director Hurd, just a few months ago, were down in the Hampton Roads area also to visit with behavioral health and psychiatric hospital leaders to talk about some of the challenges and opportunities that exist in this era where we're seeing a heightened demand for mental health, behavioral health, substance use treatment services. So that's another example of your level of activity here, and certainly appreciate that. One strategy to reduce disparities, which you've referenced, is enhancing access to care and treatment. You mentioned prescription drugs. Certainly, this administration has taken action to make insulin more affordable. In the prior administration, the Obama administration, the Affordable Care Act was passed, which included a number of provisions, including insurance reform, but also, most importantly, enhanced access to Medicaid enrollment and eligibility through Medicaid expansion. In Virginia, our legislature approved Medicaid expansion in 2018 with new enrollment beginning in 2019. Hundreds of thousands of Virginians since then have enrolled in coverage through this program. In Virginia, hospitals are actually covering the state share of financial costs, which is hundreds of millions of dollars a year, expressing that commitment to enhancing access to care. During the COVID-19 public health emergency, there was a provision of continuous enrollment for people who were in Medicaid. They were Medicaid beneficiaries. With the conclusion of the public health emergency in May of 2023, that continuous enrollment period began to wind down, and now Virginia and other states are going through redetermination. As a result of that, the federal government insurance marketplace, where people who may not qualify for Medicaid but might still be able to purchase coverage with tax subsidies or other assistance, has expanded the enrollment period or extended the enrollment period because of this Medicaid redetermination. It was supposed to expire July 31st, as I understand it, but now has been expanded through the end of November of this year. So if you would, Director Hurd, tell us about that extension for marketplace enrollment and some of the coverage options that are available for folks who might not be Medicaid eligible.
First, let me say, Julian, that that's a tremendous benefit for individuals who are in Virginia. So this was the first year that Virginia set up its own marketplace, and so we're so proud to be a partner. Up until then, they would go into healthcare.gov and they would be able to sign up. So as of April of 2023, there are more than 745,000 people who are covered under Virginia's Medicaid expansion, and we are so happy to see that that number continues to grow. We want to make sure that people have access to information, that they have access to what's happening in Virginia, and they're able to make good decisions for not only themselves and their families. And so you're right. There was a time that when the public health emergency ended, we wanted to make sure that people on Medicaid, not only in Virginia, but in other states across the country, that they did not fall through the cracks. They wanted to make sure that they had access. And so what we set out to do as the federal government is work with those Medicaid agencies, DMAS in Virginia, to make sure that people had access to information, that if they needed that information in another language, that limited English proficiency, that they had information in other languages, that they could access the call center. We wanted to make sure that people knew that they had to do something. So if they were to receive something in the mail, complete that information and send it back. We don't want anyone to be disenrolled for procedural reasons. And so with that, we worked with those agencies across the country, leaned into the space of notifying individuals upon many sectors, whether it is getting a letter in the mail, hearing it on an advertisement, seeing it in public transportation spots, and even those individuals who don't have a permanent address, for example, the homeless. We wanted to make sure that we're working with organizations that homeless individuals can access, whether that be a library, whether that be a site where they can get information and tools, that mail was sent to them in a safe, effective manner, and that individual who doesn't have a permanent address but could get and receive mail, that they knew that Medicaid was going through a renewal process and that those individuals had to take an action. It wasn't going to be automatic the way it was during the pandemic. They had to take an action to renew their coverage. So we're really happy that that has happened. And now, as you mentioned, we are still into the process of Virginia getting assistance for their health insurance up until November of 2024.
Yeah, and I'm glad you made that point about the fact that Virginia, after having previously relied on the federal marketplace, healthcare.gov, has now established its own marketplace where Virginians can shop for coverage options. And for the benefit of our audience, That web address is marketplace.virginia.gov. Again, marketplace.virginia.gov for anybody who may need to explore their coverage options. Director Hurd, I want to thank you for spending some time with us today, for sharing your insights with us, discussing some of the programmatic initiatives underway at HHS. Before we let you go, we do have a tradition here on the podcast to ask our guests a pair of fun, sort of quirky personal questions as we just before we part. To keep things interesting, we have a list of 10 mystery questions. So if you select two numbers between 1 and 10, I will ask you the corresponding questions.
Okay, let's do number 2, and let's do number 8.
Okay, number 2. If you were stranded on a deserted island, what one book, one album, and one movie would you take with you to keep yourself company? We will spot you a copy of the religious text of your choice. So other than that, what are your 3 entertainment survival kit picks?
Okay, one book, one album, and one movie?
Correct.
Okay, so my movie would have to be The Long Kiss Goodnight.
Okay.
With Gina Davis and Samuel L. Jackson.
I'm familiar. He's always frank. He's always frank and earnest.
Absolutely.
I would have been here sooner, but I was thinking up that ham on ride line.
You think I can't take him? Now you probably scared the other ones away.
What up?
Headhunters, Nimrod. They don't travel alone. You're always this stupid, or did you take lessons?
I took lessons. Hey.
The other one is the album would be Aretha Franklin. My mom used to play Aretha Franklin when I was younger, and so I grew up listening to her. And so anything by Aretha Franklin is good.
I love Aretha Franklin's version of "You Send Me." It is one of my
say
favorites.
A little prayer.
Indeed.
And then the last thing would be a book. I would have to say Jane Eyre.
And then you selected number 8. That question is, tell me one memory from your life that whenever you think of it, it makes you smile.
Okay, on the fly, I know we're closing. So I would have to say growing up in a small church in St. Louis, Missouri. And my mother is the youngest of 9. So it was a family church. My aunt sat at the end of the other row. The other aunt sat behind. Then another aunt sang in the choir. And my uncles were there. And so whenever I think of that church in St. Louis, I think it makes me smile because it just reminds me of community. It reminds me of family. It reminds me that I was invincible.
I grew up in a church like that with my father's extended family in New Jersey, so I can certainly appreciate and relate to that. And with that brings us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Director Melissa Hurd of HHS Region 3, for joining us today. So thank you.
Thank you. It was a pleasure.